The eyes are really the first thing that are noticed on a person. When it comes to the aging process, there are certain signs that you're going to start seeing around the eye area. When it comes to the upper eyes, you start seeing a lot of that extra skin in the area. Oftentimes looks sort of crepey, starts to droop over the eyelashes themselves. In some patients, you'll also get some fullness on the inside of the eye over here. That represents two of the fat pads that are found in the upper eyelid. And in some patients, they will begin to start pushing forward. With the lower eyelid, you'll see some of the same findings. You'll see some of the extra skin start to develop in the lower eyelid there. You'll oftentimes notice that your makeup starts to cake in the area, or when you smile and stop smiling, the skin just kind of stays in that area. Although there are two fat pads in the upper eyelid, there are three fat pads in the lower eyelid, and you'll start seeing those start to push forward to a different extent in various people. The reason that does that is when you were younger, that fat was held sort of behind a nice tight membrane, and as that time goes on, that membrane weakens and starts to push forward. In other patients, it comes a lot earlier in life, and that's usually more of a genetic condition. It's your younger patients around age teens, 20s, even 30s who really notice the fullness to the area. There are various ways to treat these different conditions. For the upper eyelid, the most common way to treat those areas is surgically, where you simply make an incision in the natural crease that goes above the eyelid right there. We remove the extra skin, and if there's a case of extra fat, that's removed at the same time. And that incision heals very quickly, very well, and is almost imperceptible. With the lower eyelid, there are a few more options that are available to you. If you start to see the fat, and that's all that's seen, talking back to those younger patients again, oftentimes what we can do is make an incision below the eyelid, crease itself, so behind the pink part of the eyelid. No external incision is done. You simply remove the fat, or sometimes you'll reposition the fat in that area in order to help make for a more smooth contour to the location. When it comes to the extra skin, you have a couple options. If it's a minimal amount of extra skin, then one of the things that you can do is a resurfacing technique. That might mean your chemical peel or your laser. It really just depends on the extent of the skin in the area. For more advanced signs of aging, when there's a lot more extra skin to the area, that's more where to surgically remove things. You have a couple options in that area. You can make an incision directly below the eyelid crease itself, below the eyelash margin itself. The nice thing about that incision is it's camouflaged almost immediately by the eyelashes. The drawback with that particular incision, though, is that you will sometimes see some patients that get some rounding in the corner of the eye over there. To help minimize that risk, what we'll oftentimes do is make that incision just a little bit lower in the first wrinkle of the skin, first wrinkle of the eyelid. Make the incision in that location, remove the extra skin, and that really decreases that risk of pulling the eyelid down. That can also be used to remove the fat in the area and the skin in the area. Or another combination, you can remove the fat from the inside of the eyelid and then do what's called a skin pinch, where you should remove the extra skin on the outside of the eyelid. So those are all various options. For the patients who are beginning to see some of the signs with just that bag starting to push forward, what you can do is you can put some filler in the area below the eye to help camouflage it. Sometimes we'll do a fat transfer below the eye to help camouflage it. And other times we'll do what's called fat repositioning, where we use the own eyelid fat to reposition along that crease. As you can see, there are lots of various ways to improve the areas around the eye. It really just depends on the condition that you have and what we're trying to accomplish with it. Thank you.